Hello, everyone, and welcome to day 3 of Black Maternal Health Week. I'm Dr. Jamila Taylor, Director of Healthcare Reform and Senior Fellow at the Century Foundation, a progressive think tank focused on advancing racial, gender, and economic equity. Thank you all for joining today's event. What an incredible lineup of speakers we have planned for the next hour. First, I want to thank our amazing partners for this event, the National Birth Equity Collaborative, and especially Black Mamas Matter Alliance, an organization that created this week-long campaign 5 years ago and has led it and grown it every year since. I also want to thank the Black Maternal Health Caucus, co-chaired by Congresswoman Alma Adams and Congresswoman Lauren Underwood, both of whom we'll hear from shortly. We are also joined today by other Black Maternal Health Caucus champions, Senator Cory Booker and Congresswoman Ayanna Pressley. We are so fortunate to have such tireless champions in Congress working alongside us. In addition, later in our program, you'll hear from Health and Human Services Secretary Xavier Becerra, whose support and work on behalf of Black mamas has been absolutely critical. Thank you so much for your commitment to Black mamas, Secretary Becerra. For folks that may not know, the theme for this year's week is Building for Liberation, centering Black mamas, Black families, and Black systems of care. So what does centering Black mamas and Black systems of care look like? It looks like a country in which Black women are no longer 3 times as likely to die of pregnancy-related causes as white women. It looks like a world in which Black women express pain or discomfort to medical professionals, and they are not only listened to and believed, but they are met with culturally sensitive and anti-racist high-quality care. It looks like expanding access to doula care and extending postpartum Medicaid coverage to 1 year. And yes, it looks like finally passing the groundbreaking package of 12 bills known as the Black Maternal Health Momnibus. Over the next hour, we'll dig into policy details and you'll learn more about the historic provisions included in the Momnibus. As we do, let us remember that we are closer than ever to achieving these game-changing policy wins because of the leadership of Black women, because our movement, our champions in Congress, and the Biden-Harris administration have centered Black mamas. And continuing to center Black women and Black leadership is precisely how we're going to get over the finish line and tackle the Black maternal health crisis in this country once and for all. Throughout today's event, be sure to join the conversation below and tweet along using the hashtag BMHW22. You can also follow along with Black Mamas Matter Alliance, the National Birth Equity Collaborative, the Black Maternal Health Caucus, and TCF on Twitter. Now, I'd like us to start off with some introductory remarks from one of our champions in Congress, co-chair of the Black Maternal Health Caucus, Congresswoman Lauren Underwood. Thanks so much for joining us today. Over to you, Congresswoman.
Hi, everyone. My name is Congresswoman Lauren Underwood, and I have the honor of representing Illinois' 14th Congressional District. And I'm a co-founder and co-chair of the Black Maternal Health Caucus alongside Representative Alma Adams. I would like to welcome all attendees to today's event, and I wish you all a very happy Black Maternal Health Week. To the Black Mamas Matter Alliance, the National Birth Equity Collaborative, and the Century Foundation, thank you for hosting this important conversation. And thank you for all that you're doing to end our nation's Black maternal health crisis. The Black Maternal Health Caucus is proud to be working with you on this urgent mission. Since Congresswoman Adams and I co-founded the caucus 3 years ago, we have worked tirelessly with advocates across the country to advance legislation that would save lives and advance birth equity. And in the past year, we've made enormous progress, from the first Momnibus bill being signed into law to the first ever Maternal Health Day of Action Summit at the White House, hosted by Vice President Harris, to the passage of every eligible Momnibus provision and a permanent expansion of year-long postpartum Medicaid coverage in every state through the Build Back Better Act in the House of Representatives. Today, we celebrate these historic achievements while also recommitting ourselves to all the work that is ahead of us. We've come so far, but we're just getting started. I'm so thankful to be doing the work with each of you. Thank you again for joining this event and enjoy the conversation.
Thank you so much for joining us today, Congresswoman Underwood, and thank you for your critical work on this issue. And with that, I'm absolutely thrilled to introduce our keynote speaker, Vice President of the United States, Kamala Harris. Long before becoming vice president, Kamala Harris has been a champion for Black women and advancing maternal health equity. We are so honored that she's here with us today for this monumental event. Vice President Harris, take us away.
Greetings, everyone, and thank you to Dr. Jamila Taylor for bringing together this extraordinary group of leaders. To the Black Maternal Health Caucus, the Century Foundation, Black Mamas Matter Alliance, and the National Birth Equity Collaborative. Thank you all for your unwavering partnership and tireless advocacy. Today we mark Black Maternal Health Week, thanks in large part to the advocacy of the Black Mamas Matter Alliance. One of the purposes of this week is to address the national crisis. Before, during, and after childbirth, women are dying at a higher rate in America from pregnancy-related causes than in any other developed nation in our world. On top of that, regardless of income level, regardless of education level, Black women in America are 3 times likely to die from pregnancy-related complications. And we know a primary reason for why this is so: systemic inequities, the differences in how people are treated based on who they are. And they create significant disparities in healthcare outcomes, disparities that are often a matter of life and death. For years, I've worked in close partnership with so many of you to ensure our nation treats Black maternal mortality as the crisis it is. As a United States Senator, together with Congresswoman Alma Adams, I introduced one of the first bills in the history of the United States Senate to target racial disparities and implicit bias in the healthcare system. The name of it is the Maternal Care Act. With Congresswoman Adams and Congresswoman Lauren Underwood, I introduced the Black Maternal Health Momnibus Act to improve maternal nutrition, to expand affordable housing, and to grow our maternal health workforce to include more doulas and midwives, because we must create a more community-based approach to maternal health care. I also worked with Congresswoman Yvette Clarke to take on the issue of uterine fibroids, and we did that through the Uterine Fibroid Research and Education Act. As many of you know, Black women are 3 times more likely to be hospitalized as a result of this condition. And together, we have continued our fight from the White House. We are allowing states to extend Medicaid coverage to postpartum women from 2 months to 12 months by passing the American Rescue Plan. And in December at the White House Maternal Health Day of Action, we launched a new initiative to rate our nation's hospital based on the quality of their maternal health care. And we announced our private sector partners would invest $20 million in maternal health efforts domestically and more than $150 million globally. None of these accomplishments would have been possible without your hard work. The organizers, advocates, healthcare professionals, and elected officials who are here today. To lift up the stories and the voices of Black women, we must continue with this work. And we know we have a lot more to do, but I know we are in it together. So this week, let us recommit to the mission we all share, building a future in which being Black and pregnant is a time filled with joy and hope rather than fear. Thank you all for your leadership. Take care.
Thank you so much for joining us today, Vice President Harris, and for your tireless work to support Black mamas. Now let's turn to our first panel, which features Congresswoman Alma Adams and Congresswoman Ayanna Pressley. The panel will be moderated by Angela Ayanna, co-founder and executive director of Black Mamas Matter Alliance.
Greetings, everyone. My name is Angela Doyne-Solomon, the co-founding executive director of the Black Mamas Matter Alliance. Here at the Alliance, we're a national network of Black women-led organizations and multidisciplinary professionals who work to ensure that all Black mamas have the rights, respect, and resources to thrive before, during, and after pregnancy by performing critical, needed community-based services throughout the maternal and reproductive health period for all individuals and families. I am thrilled to moderate today's panel on passing the Momnibus and year-long postpartum Medicaid coverage. Our panelists are Congresswoman Alma Adams, representing the 12th Congressional District of North Carolina, and the co-chair of the Congressional Black Maternal Health Caucus, and joined by Congresswoman Ayanna Pressley, representing the 7th Congressional District of Massachusetts, and a member of the Black Maternal Health Caucus as well. Thank you both for championing Black maternal health and for joining me in this conversation today. And so, for Representative Adams, could you tell us about the development of the Momnibus and what it seeks to accomplish and the story of your bill, the Kira Johnson Act?
Thank you, Angela. It's good to be with you, and of course my colleague Ayanna Pressley. For me, all of this work began when my daughter, a Black mom herself, survived a complicated pregnancy that almost claimed her life after complaints of pain in her abdomen were overlooked by her physician. And while my daughter Janelle is still with us, how many people my age aren't as lucky and now have grandkids who will grow up without a mommy? And that's why in 2019, I asked the youngest Black woman elected to Congress if she wanted to launch a congressional caucus focused on Black maternal health, and Congresswoman Underwood did not hesitate. We wanted to raise awareness, to educate our colleagues, and to shine a bright spotlight on the maternal health crisis of mothers needlessly dying during what should be one of the most joyous times of their lives. And after months of soliciting stakeholder input, we introduced the Black Maternal Health Momnibus Act, a comprehensive solution that builds upon existing maternal health legislation by filling gaps to address every dimension of the maternal health crisis in America. A key component of Momnibus is my signature bill, the Kira Johnson Act. On April 12, 2016, Kira and her husband Charles arrived at the hospital for a routine C-section to deliver their little boy, Langston. And after the procedure, Charles noticed blood in Kira's catheter, and he alerted the doctors to it. And the doctors determined that her condition was not a priority, and they waited more than 10 hours as she deteriorated, and she lost 3 liters of blood along the way. Eventually, she passed on early the next morning. Langston was 11 hours old. So Kira deserved better, and so do the Black mothers across the United States who are dying at disproportionately high rates. Kira's story hits close to home because it is so common in our community. You know, I've spoken with countless women who know either a survivor or victim of the maternal health crisis, or who survived it themselves. It transcends education levels, it transcends wealth and insurance status, and it can happen to anyone. So I know that Kira Johnson, this act, and the entire Momnibus Act will save lives of Black mothers and keeping more women with their families.
Thank you so much for that. Representative Pressley, could you tell us more about the Justice for Incarcerated Moms, including how it came together and how it would support Black mamas in the criminal legal system?
Absolutely. And again, I just want to say what a joy, privilege, and an honor it is to sit at this virtual table with both of you and to do this work in partnership with my big sister and colleague here, Representative Adams, which, you know, I do just want to take a moment just to acknowledge just the power of representation. You know, were it not for the Congressional Black Caucus, and were it not for Black women in the Congressional Black Caucus, there would not be a Black Maternal Health Caucus within the CBC. And so when we say that we are the voice of Congress, we mean that. And so I want to thank Representative Adams and Underwood just for their visionary leadership. As for the Justice for Incarcerated Moms, I just want to start by recognizing how critical it is, Angela, that we continue to hold conversations like this. this platform today, that we're centering Black mamas in our fight to advance health equity. The racial inequities in maternal health, they're not naturally occurring. These are the results of what I would characterize as policy violence, centuries of racist policies and laws. So these are the result of centuries of laws and a systematically racist healthcare system that too often discounts our pain, ignores our voices, disregards our lives. Birthing while Black should not be a death sentence. And like Representative Adams and so many who come to this movement, the fight is a personal one for me. My paternal grandmother, Grandma Carrie, who I never had the blessing to know, died in the 1950s, giving birth to my father's youngest brother, sending my father and his 5 siblings into a spiral of great trauma and hardship. And decades later, the Black maternal mortality crisis continues to rob us of our loved ones and to destabilize families. Speaking of destabilization of families, mass incarceration certainly does do that. And, as Angela Davis reminds us, people think that social problems go to jail, but people do. And, all pregnant people deserve to be treated with dignity and to have access to care, including those who are incarcerated. Today, women are amongst the fastest growing population within our prison system. 5% of women in prisons and jails across the nation are pregnant, and 80% are mothers. Again, social problems don't go to jail, people do. Someone's mama. Birthing people in prisons and jails are regularly shackled during labor and birth and separated from their newborns shortly after giving birth, denying them the chance to breastfeed and bond with their babies, and leading to adverse medical outcomes for both moms and infants, and can lead to the permanent separation of families. I can't believe that we have to legislate humanity, but indeed we do. And so my Justice for Incarcerated Moms bill would first provide funding to incentivize states and local prisons and jails to finally end the practice, we have to legislate this, to end the practice of shackling pregnant people. Secondly, it would support the creation of programs at state and local prisons to improve care and support for pregnant and postpartum people, including access to doula services and midwives, healthy foods and nutrition counseling, pregnancy and childbirth education and parenting support, and maternal infant bonding opportunities. The bill would also establish, and I think this is key, funding for diversion programs as alternatives to incarceration for pregnant people and primary caretakers of minor children, because they should not be incarcerated in the first place. And lastly, the bill would authorize the first ever study on maternal mortality and severe maternal morbidity among incarcerated people. We cannot manage what we don't know. And that's why the data collection is so important. Black women are imprisoned at twice the rate of white women in our nation. So it is clear improving maternal health outcomes behind the wall is key to advancing Black maternal health. And I'm grateful that this bill was included in the broader Momnibus.
Thank you so much for that, Pressley. And then could the both of you speak to the importance of postpartum Medicaid extension for 1 year? And we can start with you, Rep. Adams.
Well, thank you very much, Angela. Listen, this is really, really critical. It's a matter of life and death. Medicaid covers about 1 in 5 women of reproductive age, making pregnancy-related care accessible for more than 40% of people giving birth. I worked really hard as a member of the North Carolina House trying to get Medicaid expanded. But as many of the maternal deaths and close calls we see are postpartum, after the mom has delivered a healthy baby, after she has delivered. So a third of maternal health occurs between 1 week to a year after childbirth, and Black women suffer 3 to 4 times more pregnancy-related deaths than white women. In my home state of North Carolina, we rank 30th in the nation in maternal mortality, and upwards of 12% of women experience postpartum depression. So if Congress permanently expands postpartum coverage for 1 year, then moms would be able to access the care that they need to manage chronic conditions and to meet behavioral and mental health needs. And this would have an immediate effect lives would be saved, health outcomes would improve across the nation. So I'm grateful that as of April 1st, 2022, that moms in North Carolina are now eligible for 1 year of continuous postpartum Medicaid coverage. This benefit is available through 2027. But our work's not done yet. We've got to continue making progress so that this coverage is available in every state and permanently.
Absolutely. And I would be remiss if I didn't also uplift a victory here in the state of Georgia, and all of our great advocates here at the state level who too have helped us propel for the state legislators to really get behind expanding postpartum Medicaid coverage up to a year as well. So we too are celebrating that victory, and we want to see more of that happen across the South. Also, Rep. Pressley, can you too speak to postpartum Medicaid extension to a year?
Well, Rep. Adams did such a compelling and convincing job there, and you came behind lifting up that important state victory. And so I guess I would just round it out and simply say that we're grateful for the leadership that has occurred in our states. Another reminder that offices matter at every level of government. But we need this to be, federal law. We want to ensure that, every Black mama has the opportunity to survive and to thrive. And so that's why I introduced legislation, the Mommies Act with Senator Booker, which aims at finally extending this Medicaid coverage and ensuring that it can support the full range of postpartum supports necessary for new mamas. It's just absolutely critical, as has already been stated. And the fact that the United States has the highest rate of people dying of pregnancy-related complications during or within the 12-month postpartum period, and this trend is only getting worse. The rate is higher than it was 25 years ago. So this is quite literally a matter of life and death.
Absolutely. And so while we've seen one of the momnibus bills get passed through, which is the Protecting Moms Who Served Act, what can we do to ensure that these historic policies and investments in Black mamas and perinatal workers are signed to law? Rep. Pressley, can we start with you and then round it out with Rep. Adams?
Sure. The reason why we've made the progress that we've made to date has everything to do with, impacted families, survivors who have told their stories. And I look forward to a day where people do not have to relive their trauma, weaponize their pain in order to have their humanity seen and their dignity centered and their lives prioritized. But in the meantime, we just have to continue to lift our voices and our lived experiences. Holding conversations like this to raise awareness is really key. Again, the reason why there is a Black Maternal Health Caucus, the reason why there is the Mommies Act and so many other pieces of legislation within this momnibus is because of this broader movement, which has continued to grow. And so we can't cede any ground. We have great momentum, and we have an incredible champion and ally in this fight with Vice President Harris in the White House. I have to lift that up. And so we can and we must get this done. We made incredible progress. There have been great gains in advancing the 1-year Medicaid coverage in the Build Back Better Act. And we must ensure that that is included in the next reconciliation package. So I will end there and pass the virtual mic to my sister colleague there.
Well, thank you so very much. In 1962, Malcolm X said that, and I quote, that the most disrespected person in America is the Black woman. The most unprotected person in America, he said, is the Black woman. And the most neglected person in America is the Black woman. And sadly, that continues to be true and evident in health and economic outcomes that we continue to face. This pandemic has revealed a lot of the disparities all too well, and it's further exacerbated them. I recall in 1966, well before that sister was probably born, at a press conference for the second convention of the Medical Committee for Human Rights, Dr. Martin Luther King is quoted to have said, of all of the forms of inequality, injustice in healthcare is the most shocking and the most inhumane because it often results in physical death. However, we're not languishing in despair now. We know what needs to be done. You know, if you know what you need to do, we need to do it. And so we know that the key interventions included in the Momnibus will improve health outcomes for mothers while also reducing racial disparities in infant mortality. So what more can be done? Well, as my Congresswoman has just said, you know, we're going to have to continue to advocate. Call your representatives, call your senators, tell them you want to support the Momnibus. Voice your support online, talk to your friends and your family about the issue, but we've got to keep the conversation going because no one should have to lose another friend, another auntie, another sister, another daughter or mommy to this crisis. And it doesn't matter what your political beliefs are. Either you have a mother, you are a mother, or you know women who are moms. And so when we raise the tide for Black women, who are among the most marginalized and the most vulnerable, we ultimately raise the tide for all women. All moms deserve equal access to quality maternity care without bias. And we've got to continue to work to make sure that that happens. So I appreciate the opportunity to speak with you today. And let's pass the Momnibus right now. Our mamas cannot wait.
Absolutely. Thank you so very much, Representative Adams and Representative Pressley, for your time today. Thank you so much for standing with Black mamas, Black families, and just communities that are really impacted by this maternal health crisis. And thank you for championing Black maternal health rights and justice on the Hill and through policy and through the work that you all continuously do. For more information about the Black Mamas Matter Alliance, we ask that you visit our website at blackmamasmatter.org and continue to get engaged in our 5th annual Black Maternal Health Week campaign all throughout this week. Thank you all so much. Have a good one.
Thank you.
Thank you.
Thank you very much.
Thank you so much, Congresswoman Adams and Congresswoman Pressley and Angela, for that discussion. And thank you for all of the work that you do to advocate for these policies that change so many lives. In our second panel, you'll hear from Senator Cory Booker, Congresswoman Lauren Underwood, and moderator Dr. Joya Perry, founder and president of National Birth Equity Collaborative. Over to you, Dr. Joya.
I'm Dr. Joya Perry. I'm an OBGYN by training and the founder and president of the National Birth Equity Collaborative. And our organization is 7 years old now. We work really to ensure that Black people around the world, transnationally, are able to thrive. And that means focusing on moms, babies, families, and communities to ensure that we undo the harms of racism, of sexism, of gender oppression, and really look for justice and joy. And I am so honored today to be joined by my colleagues, Senator Booker and Congresswoman Underwood, as we talk about Black maternal health, because this 5th anniversary of the Black Maternal Health Week, it also reminds me of how we got started. Back in 2015, I was invited to the Mother House in Atlanta for a meeting where researchers from around the country were talking about the fact that Black birthing people were dying at 3 to 4 times the rate of their white counterparts. And what were we gonna do? And that was the birthing of the Black Mamas Matter Alliance that I get the honor and privilege of being on the founding board of today still. And so this is a conversation really that started from that room to us having a Hill briefing in 2016, where my good colleague, Cherie Scott, said America was built on the wombs of Black women in the People's House, right? And so that's a continuation of us being able to bring that conversation and understanding that we have had from Atlanta to Botswana, that knowing that the people of this country and around the world deserve to have investment in and to be seen in the future, and really focusing on how we got to this Momnibus today. So the Momnibus was, for us, especially at NBAC and my partners across the Black Mamas Matter Alliance, it was the first time that we got asked first. Usually people create bills, you know, senators, congresswomen, people create bills and they come to the grassroots orgs afterwards and say, what do y'all think? this was the first time that people came to us and said, what do y'all think from the beginning, off top, as we would say, right? What do Black people think we need off top? And that's why you see the most comprehensive package, because this was something that came from the people. The people created this bill. And the people created this bill alongside Senator Booker and Congresswoman Underwood. So that's why it's so robust. And that's why it cannot lose. It cannot lose because the people created it, right? So with that, I would love to hear from our colleagues, Representative Underwood and Senator Booker, and what about next steps.
Well, Joya, thank you so much for having us. Senator Booker, what a treat to see you again in celebration of Black Maternal Health Week. We have made so much progress over the last couple of years to advance the mommy bus, and we could not have done it just here on Capitol Hill. It is really a testament to the incredible advocacy and the work of our stakeholder community all across this country, and the continued advocacy that has pushed the mommy bus to see one of our bills being signed into law, the Protecting Moms Who Served Act, which is our veterans related bill. One has passed the House with bipartisan unanimous support, which is the Maternal Vaccination Act, to address what we've seen in COVID-19 and some of the long-standing disparities in maternal vaccination rates. And then 80% of the rest of the bill was included in Build Back Better that passed the House of Representatives. Every single eligible provision of the mommy bus was in the House passed version. And so we're talking about provisions like the Social Determinants for Moms Act, which would address housing and transportation and environmental issues. We're talking about growing and diversifying the perinatal workforce, right? So we can have more and more diverse physicians and doulas and lactation consultants and midwives and nurse midwives, right? We are actually offering funding for these community-based organizations that have been doing the work for so many years in a hyper-local way, who've seen the impact of their interventions, and it will hopefully enable folks to be able to grow and scale this work so that more families, more birthing people can benefit from the work that these organizations are doing on the ground. We can't neglect the role of maternal health and behavioral health and the rise in substance use disorders, addiction, and suicide in this population that we're serving. And so what we want to do is make sure that we have resources, we have specialists, we have providers who are prepared to help to address this rapidly growing threat of maternal mental health and substance use disorders. We're not neglecting the research. We've had some early wins in the research area, but we're continuing to invest in both the research and the digital tools that will help put access to evidence-based information in the hand of every birthing person in this country. Because when we think about maternal health equity, there is an information gap. And we wanna make sure that we are not continuing to drive this digital divide, which has put our community in many cases at a disadvantage.
Wow, I have to say, Congresswoman, this is why you are one of our most beloved members of Congress. You just rattled off like an entire agenda. Other people get one little bill. You're like, this is an entire.
This is it.
This is it. This is all the things. And when I remember meeting you at a meeting on the Hill, and you said to me afterwards, Joya, this is functionally like policies are also dictating people's lives. And you just really took that and you ran with it. And I'm so excited. And going to Senator Booker, I work a lot with our colleagues in New Jersey who've been working around like Medicaid expansion and thinking about what would it look like for states to continue to build on investment in our infrastructure. So I'd love to hear your thoughts on this bill.
Well, first of all, I just want to say thank you. You described the bill right. This was a grassroots up bill. This is where advocates and experts really informed what we were able to do. The Mom the Bus is a reflection of folks who are in the trenches every single day, who understand these issues, understand the need, understand the urgency, and understand with considerable empathy the pain for so many Black families, Black moms, and the Black community as a whole. So I rejoice in that. And then you have champions in the House, and you said it. Rep. Underwood is a phenomenal leader amongst leaders, because our Congressional Black Caucus has been 100% behind this. And then something spectacular for me being over here in the Senate, where then Senator Harris and I were the partners with Rep. Underwood and others. She suddenly gets kicked upstairs to the White House, and now she's vice president. And so before that administration before Senator Harris became Vice President Harris and Vice President Biden raised his hand and became President Biden, this was a part of their agenda to partner with us, House, Senate, White House, in a line to move as much as we could. And so as Rep. Underwood said, we had pieces of this that have gotten done, of our Mom the Bus bill. There were huge chunks of it included in the original Build Back Better effort, and are still a part of the reconciliation. That's a fancy word for what we need to do here in the Senate and getting things done with just 50 votes because Republicans are blocking us. This is still part of the conversation and still something we're pushing for because we know the crisis. If you just look at Medicaid alone, it covers a significant amount of all births nationwide. Some states it's upwards of 70%, and it's challenging because Medicaid, as it stands right now, needs to be improved. We know that 1 in 5 maternal deaths occur between 6 weeks to a year following childbirth, which means retaining Medicaid coverage becomes essential to preventing maternal deaths and, frankly, in ensuring not only the health of the mother, but the health of the baby. And we also know from cost-benefit analyses, by shortchanging on Medicaid, you often create enormous expenses for the taxpayer if it's a premature birth or if there are other complications, not to mention the immeasurable and uncountable value of every single human life. And so this is why I'm so proud of the momentum we have in the Senate, and clearly the leadership we have in the House is to deal with things like the Medicaid challenges and inadequacies and expand it. You know, one of my original bills in this area, again, informed by grassroots leaders, activists, and experts, was the Mommies Act, which includes a provision to extend the current 60-day limit to postpartum coverage to 1 year. It's so obvious to do the FMAP funding to make sure that states do that. And again, this is what was planned for the Build Back Better plan that Biden had. So we are still pushing. And the one thing I'll say before I pass it back to you, Doctor, is that I love the consciousness shift, that this became something that people were not aware of, the crisis, that Black women were dying 4 times more in childbirth than white women. But we already had we're one of the worst nations of developed nations for maternal mortality. And then when you disaggregate the numbers, it's so much more of a reality for Black women. But I think that more people know the data, but it's not just knowledge. It's now we're seeing more and more action and more commitment. And, you know, I still remember when my staff started hearing me running around talking about things like doula care and how proud they were to see this guy that even knew what doula care was. But the reality is we are trying to do what our former colleague talked about, create a more beloved community. And the beloved community can't just be sentimentality. It has to be making sure that every birthing person has all the resources and support they need to usher in the next generation of leaders, of congresspeople, of doctors, of presidents, and more, Supreme Court justices, and more. That's what we need to do in this country. And I'm glad that we've got some good momentum right now.
I love that, you know, and it really, thank you so much. As a part of our work, we start off with truth, and that was a lot of truth you all did. You have to have truth till we get to racial healing and then transformation. So this, talking about the importance of repairing damage that has happened in the past. So many of the bills that you all have put forth are really reparative. I mean, when I was growing up, we used to use the word affirmative action, but we haven't even repaired the actions yet. So this is really the bills and the policies you're talking about: Medicaid extension, mental health care services, postpartum, having access to doulas, having more workforce. I can say, as an OBGYN who's been on the board of the National Medical Association for 10 years, we have very few Black physicians, OBGYNs. So we need more Black OBGYNs, more Black midwives, more Black doulas. We need it all, right? And the HBCUs, as a person who grew up in Grambling, Louisiana, you know, I love this idea of really investing in where Black excellence is created from Howard to Hampton to Grambling to FAMU, like across the world, we have Black excellence already going. So thinking through that, Congresswoman, what are some things you're thinking about for the next steps? Now that we have this momentum so far for the Momnibus and we've got things going, what are some other future ideas that you have for Black birthing people?
Oh, I'm so excited. We just had the federal funding bill signed into law. We've made some great strides in funding some existing programs. Obviously, the Momnibus is moving forward. I have faith in our Senate colleagues that there is a deal to be had and that our maternal health provisions will remain in that legislation. And so we're thinking about Momnibus too. And what could that legislation look like? There are existing problems that are contributing to severe morbidity. So the Momnibus is designed to address the mortality crisis. Why are moms dying? And we identified with your help, Joya, and all the stakeholders around the country, the leading causes of maternal death and this disparity that we see for Black moms, and we crafted an evidence-based, data-driven policy. So when we get this reconciliation done, we can look to address severe morbidity. And there's these long-standing issues like endometriosis and fibroids and infertility and stillbirth and pregnancy loss that have been over-stigmatized and they've been under-researched, and they are contributing to the severe morbidity. We know that domestic violence has been a persistent issue. Congresswoman Gwen Moore has continued to focus our energies on this piece that we know impact Black birthing people, but also our larger multicultural coalition, right? Because we know that when we lift us up, it helps everybody, right? And improves outcomes for everybody. We are continuing to keep our eye on including pregnant and lactating people in clinical trials. What's happened during this pandemic has just underscored how we need to be more assertive and forthcoming and insisting that pregnant and lactating people are included in the trials so that we can be included in the recommendations. We can have the treatment options available to us, and quite frankly, that we have a pathway of addressing some of these longstanding issues like preterm birth, where we know that we could have an intervention if only we had a mechanism to have these trials. And so I'm excited about that. And then NIH, the Black Maternal Health Caucus had a fabulous conversation with the outgoing NIH director, Dr. Collins. And he, in that conversation, committed to doing something, and it turned into the NIH Improve Initiative, which is housed under NICHD, the National Institute for Child and Human Development. And we just got them $30 million in the last funding bill to do this work. They've been making grants, but now if we can get the authorizing language approved, that means that forevermore, NIH can do this work around the maternal health disparities and maternal mortality. And I think that this will set us on a course to continuing to have data-driven policymaking in this space.
That is so incredible. And let me just say, you use a lot of terms that as an OBGYN, like I tell people, it's 2 books, OB and GYN. So breaking those down is really important. And one of those things you talked about was the reconciliation process. And I can say that I'm learning about that. And I know that our colleague, Senator Booker, probably can tell us a little bit more about what we need through reconciliation and where we need to kind of galvanize in that space, because as advocates around the country that are watching this, it's so important for them to understand what we could do and what the next steps are for these bills that we put together with you all. So if you could help us with that, Senator, I'd really appreciate it.
Yeah, absolutely. So unfortunately, it's not written in the Constitution, but the Senate rules have evolved to have this very powerful thing called the filibuster, something I think we should change, get rid of. But the filibuster right now is the rule of the Senate, which means for most bills, you need 60 votes to get them done. Now, the filibuster was weakened for Supreme Court justices under Mitch McConnell, so there are some exceptions to that. But when it comes to legislation like we're talking about, the threshold you need to get is 60 votes, with one exception, something within the budgeting process that you can actually get a bill done for 50 votes that revolves around budget and spending. And that's what's called, the process to get that done is called reconciliation. And so it's a really powerful window that only opens once or twice during a Congress, where you can put things into a spending bill that has to sort of pass rules to be specifically about expenditures. You can get that done with 50 votes. And that's presented an opportunity for us who are concerned with maternal mortality issues to get a lot of these things done. And we seized upon it here in the Senate, as well as President Biden, to work a Senate strategy to get many of the things done that Representative Underwood talked about. And she's, you can see why she's such an extraordinary leader, an advocate and change maker here in Congress. One of the younger Congress people that we have, yet she shows the profound wisdom that she has, and also just being a great tactician and strategist and knowing the highways and the byways already of Congress to get things done. If I could just say one more thing, because she was so inclusive of a lot of our efforts, there's just one population I want to mention before passing it back to you, Doctor, which is most Americans don't realize how much we over-incarcerate women in this country. It is stunning. With all the incarcerated women on the planet Earth, people find it shocking, but it's the truth that about a third of the women that are incarcerated in the world are incarcerated here in the United States. And overwhelmingly, over 80% of those women are survivors of sexual trauma. And we put them into environments that do not have the kind of care, mental health care or trauma-informed care that they need. And we still have practices that are horrific, where some states still will shackle pregnant women down when they're giving birth. And so we have worked on important legislation within this larger momnibus context called Justice for Incarcerated Moms Act, which I'm really, really proud of. And it would create a lot of resources to create model programs and expand upon best practices for care for pregnant people who are incarcerated. It would study the issue more to make sure we are doing everything we can to end the practice of shackling pregnant people, as well as getting folks the care they need. We know, again, that this, unfortunately, we've seen these numbers continue to skyrocket of the women that we are incarcerating. We are putting hurt people who are often in need of health care, mental health care, drug treatment, and more. We put them in environments that undermine their profound work as moms, where they are charged usury rates just to call or communicate with their children, which all studies shows undermines their rehabilitation and affects the kids. We need to make sure that we don't leave anybody out when it comes to pregnant women, birthing people, and our compassion, our empathy has to be more courageous to make sure that we're being fully inclusive in this nation, in a world, in a country that still just over-incarcerates people, period, but especially people of color, and especially women of color.
Thank you so much. That's so important. And I love to brag about that the Momnibus is so comprehensive because of things like this, seeing that people, we don't leave anybody out. Nobody's free until all of us are free. And that includes incarcerated moms, that includes people who are who've been victims of substance use disorder. Like, there's so a range that we now historically have left out and said we only get one choice. This is not about choice.
Yes.
It's about investing in everybody. Everybody should be able to, the least of these is as important. So thank you for that. This is really probably our last round of questions. And I just want to start off by saying, when we picked this week, for the Black Mamas Matter Alliance, it was centered around International Day of Maternal Health and Rights, because we know internationally, globally, transnationally, that people around the world are marginalized, are harmed based upon their race, their gender, their ethnicity, their sexual orientation. And so if we could tie the Black maternal health crisis, not to just what's happening in the United States, but the rate that Black women die in the United States is also the same rate that we die in the UK, where they have universal healthcare coverage. But if you devalue groups of people, if you don't see them as fully human and see them in the future, it doesn't matter how much you invest in them with money if you don't see them as being able to thrive and into the future. So with that, I would love to hear how you all, let's start with you, Congresswoman, see advocates being able to show up in the future to support the work that you're doing so far, and what things you can see how we can support this work around Black maternal health.
Well, I am so excited. We have had the fortune of interacting with so many brilliant minds on this topic, and that has really created this momentum that has moved the Momnibus forward. You know, the politics of all of this has really shifted. We have bipartisan provisions of the Momnibus. We have a bipartisan Black Maternal Health Caucus, and we have folks who believe deeply in this mission of saving moms' lives for deeply personal reasons. And so I think that we have an opportunity as advocates to continue to push, to continue to invite our representatives and our senators to join us even people who on their face might not seem like as someone who would be interested in taking the meeting or interested in being an advocate and leading out loud, right? Not quietly, not subtly or behind the scenes. And so I would just say this is the time for us to begin requesting those meetings when members or senators are at home in their districts or in their states. It's the time to be making very specific asks. Can you co-sponsor the mommy bus? Can you get on one of the 12 bills, right? Yeah, there's many, it's a buffet to choose from here. And can they stand with us in this work and join the caucus? Those are the three asks I think that any advocate could be prepared to initiate a conversation around. And I think that we can find a lot of success in growing our list of supporters.
I love that, and Senator, I'm sure you don't remember this, but I met you at a Planned Parenthood event, a luncheon back about 2018 or so. We got an award, you and I and Maxine Waters. And really, as an organization for NBEC, we strive to ensure that people have the full range of reproductive options. So birthing, as well as abortion, as well as infertility, as well as cancer treatments, right? And so making sure that when we start talking about the case that's happening with Roe v. Wade or what's happening, that we don't take that away from the conversations around maternal health, that we always have the full range of our identities and personality. I mean, in our full range of issues come to the table together, that the intersectionality is not just a word we throw around, but we actually live it. So I would love you to talk about how you live that in your work and what some advocates can do to support the work that you're doing, Senator, and how we can continue this momentum.
Oh, I just want to thank you. Just even listening to you today lifts my spirit, and your words are very healing to many of us who are advocates but hurt. I always say, if America hasn't broken your heart, you don't love her enough, because to be in the work, there's a lot of heartbreaking realities that you confront every day, and you see humans who get tangled up in the thorny knots of life, not of their own making. And that word intersectionality is so real. Folks don't understand how all of these issues are tied up together. I was having a really tough conversation with somebody who calls himself pro-life here in the Senate. And I said, I don't understand. If you really believe, then empower women. The things that actually lower the rates of unwanted pregnancies or giving women free access to birth control, the things that actually, the number one reason women often present for making that a personal choice of ending a pregnancy is their concerns about their financial well-being. Well, women that give birth in this country have a significantly higher rate of plunging into poverty as a result, because we don't support raising children in this country in the way that our competitor nations do, with child allowances and things like that. So all of these issues there is an intersectionality that is all about empowering human well-being, and we need to discuss that that larger picture. And it's everything from what foods are available to families, to a pregnant woman to eat. Is it hyper-processed, zero nutrition foods that we subsidize? Most Americans don't realize only 2% of our subsidies as taxpayers goes to fresh fruits and vegetables, which we should be eating if all of us, no matter pregnant or not. We don't talk enough about things like paid family leave and how powerful that is to have an opportunity to be at home with a child, male or female, whoever you are, if you're a parent. All of these issues are interrelated. And so I just want to end perhaps with just a moment with my mom that I love in my life. It was when I was suffering from that debilitating illness called chickenpox. I was a 7th grader sitting in a oatmeal bath, melodramatic as can be, and my mom was leaving on a business trip. And I looked at my mom and I said, only as a 7th grader could, I said, "Mom, if you leave me, I'll die."
Are we in the same house? I feel like I was in the same tub.
Yeah. And I'll never forget what my mom did. She put down her briefcase, she went to her phone, had a long conversation with somebody, came back, switched into her sweatpants, and she rode out the chickenpox with me. And I used to tell that story as one of those moments as a child where I knew I was her first priority. I knew the depth of her love. But my mom, who worked in HR for this big corporation, IBM, she would correct me later in my life and say, that has nothing to do with how much I loved you. Every mother loves their child, but I was blessed to be one of the small percentage of women that could make that kind of phone call when my child was in need and you weren't in need. The reality is there are mothers of very sick children who are hospitalized, who are fighting for their lives, who don't have the ability in this country to be by their child's bedside. And it was this sort of stunning, as I was a late teenage, early 20s young man, understanding that, wow, how can we have a society that does not support families like that? And so I just want you to know I am blessed to be on this call with two amazing women who I admire, who I look up to, who heal me and help me in my determination in this fight. And that's what we've got to do for each other. This is not going to be solved with a flip of a switch. This is going to be a long effort. We're making gains. We're gaining ground. God bless Biden and Harris. But we've got a lot more work to do. But you all give me faith and hope that our labors will not be in vain. And we will see a day where this country doesn't just say it loves its children, but you see that love and the justice that every family has in their efforts to raise children with great well-being, great mental health, physical health, and emotional health.
I love that. And, I needed us to make sure that we tied abortion explicitly to this conversation, because the whispering is how we don't get this bill passed, right?
Yes.
So the full range of all things is what people need to have well-being. And that's the fact. And so we're not going to let you whisper us out of the mommy buses deserve of being invested in. And we are deserving of the full range of all of the things we desire, because we deserve justice and joy.
Amen.
Thank you, Senator Booker, Congresswoman Underwood, and Dr. Joya for your time today, and for your work on getting these crucial policies across the finish line. Finally, I'm thrilled that Health and Human Services Secretary Xavier Becerra is with us today to discuss next steps the Department of Health and Human Services has already taken to protect Black mamas, and how we can work together to ensure that all mamas experience healthy and joyful pregnancies. Over to you, Secretary Becerra.
Good afternoon, everyone. I want to start by thanking today's participants, from our Vice President to our leaders in Congress to the champions you heard from today leading the charge for America's moms. Special thanks to the Century Foundation, Black Mamas Matter Alliance, National Birth Equity Collaborative, and the Black Maternal Health Caucus for hosting today's gathering during Black Maternal Health Week. At the Department of Health and Human Services, we share your goals. Ensure America's moms know the joys of raising their child, that they may celebrate that first laugh or smile, soothe that first cough or cry. Every parent deserves those moments. But as you've noted, here in the U.S., far too many moms never get to experience any of that. That's what happened to HHS's own Shalon Irving, an African-American epidemiologist for the Centers for Disease Control and Prevention and a lieutenant commander in the U.S. Public Health Service Commission Corps. Shalon died a few weeks after giving birth to her daughter in 2017. This question will forever haunt me, her mother said. How did my daughter end up a statistic? No parent should ever have to ask that question, and no one should have to die after birth in order for us to take action. This issue is personal for me. My wife Carolina is a high-risk OBGYN who has devoted her career to improving pregnancy care and outcomes. What you have discussed that we must do, she does every day. At HHS, we're more than willing to take on this issue. We're doing it every single day. In September, we announced nearly $350 million in awards to every state across the nation to support safe pregnancy and healthy babies. And as of this month, as many as 720,000 pregnant and postpartum women across America can now be guaranteed Medicaid and Children's Health Insurance Program coverage, not just for 2 months, but for a full year after pregnancy, thanks to the American Rescue Plan. In addition, on April 1st, we announced the availability of $4.5 million for hiring, training, certifying, and compensating community-based doulas to improve maternal health and access in our communities most in need. Under the President's budget for next year, we intend to invest $470 million across HHS to reduce maternal mortality and morbidity. We also propose $86 million for the Office of Minority Health to focus on areas with high rates of adverse maternal health outcomes and areas with significant racial or ethnic disparities. Before Shalon Irving passed away, She wrote on her Twitter profile, "I see inequity wherever it exists. Call it by name and work to eliminate it." Shalon, we hear you. We know we have work to do, but together we can make a difference. We can save lives, and we are ready. Thank you.
Secretary Becerra, thank you so much for your remarks and your commitment to improving maternal health. I'm Mark Zuckerman, president of the Century Foundation. On behalf of TCF, I want to extend a heartfelt thanks to our partners, the National Birth Equity Collaborative and Black Mamas Matter Alliance. The message coming out of the convening today is powerful and clear. Every Black mother should have the right to a safe and healthy childbirth. Thank you to our champions in Congress and in particular members of the Black Maternal Health Caucus. And thank you to Vice President Harris for your passionate leadership. And finally, thanks to TCF's own remarkable healthcare team led by Dr. Jamila Taylor. That concludes our program today. Have a good afternoon.